COVID-19 a pandemic crisis, challenges, lessons for future *drive S. Vijaykumar in the human history, nothing has killed more human beings than the viruses, bacteria, and parasites that cause diseases. Not even natural disasters like earthquakes, volcanoes, or war. The recent 2019 navel coronavirus is a RNA virus, announced as COVID-19 by WHO. CO stands for corona, VID stands for virus disease, and 19 stands for 2019. It was first reported in DIS, 2019 from China's Wuhan city. The WHO declared the virus as a global pandemic on March 11, 2020. The first infected humans by coronavirus was in 2002 in China, but identified in 2003 with severe acute respiratory syndrome, SARS, epidemic. A second outbreak of severe illness began in 2012 in Saudi Arabia with the Middle East Respiratory Syndrome, MERS. On December 31, 2019, Chinese authorities alerted the World Health Organization about the outbreak of COVID-19. On January 30, 2020, WHO declared coronavirus a global emergency. WHO says, COVID-19 is more than 10 times deadly than swine flu. Origins of the COVID-19, according to the findings of Anderson and his collaborators published in the journal Nature Medicine, concluded that the novel SARS-CoV-2 coronavirus, COVID-19, is the product of natural evolution and not the product of genetic engineering. Most likely origins for this virus having one of two possible scenarios. In one scenario, the virus evolved to its current pathogenic state through natural selection in a non-human host and then jumped to humans. The researchers proposed bats as the most likely reservoir for SARS-CoV-2 as it is very similar to a bat coronavirus. The current epidemic would probably have emerged rapidly as soon as humans were infected, as the virus would have already evolved the features that make it pathogenic: viruses, bacteria, other germs that cause disease, and able to spread between people. In the other proposed scenario, a non-pathogenic version of the virus jumped from an animal host into humans and then evolved to its current pathogenic state within the human population. But, the chances are lower of a non-pathogenic coronavirus entering the human population and then evolving properties similar to SARS-CoV-2. Professor, Associate, and Head, Retired, Department of Economics, KGC, NAACA grade, former member of Board of Studies, Kakatiya University, Warangal, Telangana State. One outbreak of COVID-19, on January 30, 2020, WHO declared coronavirus a global emergency. By that time, India and the Philippines confirmed their first cases of the virus, with one infected patient in each country. The World Health Organization declared the virus as a global pandemic on November 3, 2020. This virus has spread to more than 240 countries around the world. COVID-19 symptoms are fever, tiredness, dry cough, aches, pains, nasal congestion, runny nose, sore throat or diarrhea, and breathing difficulties. Recent new symptoms are loss of smell or taste, intense chills with shivering, pink eyes. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and death. The COVID-19 infection will spread from one person to others via droplets produced from the respiratory system of infected people, often during coughing or sneezing, touching any infected surface or cloth, and then touching one's mouth, nose, or eyes can transmit the disease. Some people with the infection, but without any serious symptoms, can also spread the disease. According to current data, time from exposure to onset of symptoms is usually between 1 to 14 days, with an average of 56 days. In some cases, it may be 24 to 27 days. 3 to 8 weeks for patients with severe or critical disease. COVID-19, world and top, more cases, 4 counties as on 30/04/2020, world and total countries infected, total recovered recovery rate, %. Total deaths death rate, %. Active cases, total deaths plus total recovered, World 32,61,893 1,010,659 30.92, 29,714 7.0 29,21,520 USA 10,65, 444 1,47, 411 13.8 61,704 5.78, 56, 329 Spain 236, 899 132, 929 56.1 24,275 10.2 79,695 Italy 2,03, 591 71,252 34.9 27,682 13.51, 04, 657 France 1,66, 420 48,228 28.9 24,087 Source https://www.worldometers.info/coronavirus/ is C equals 0107024 94105 2 COVID-19, India, Telangana, 3 states, more cases, 3 states, best performed, and 3 states/UTS, 0 cases, as on 30/04/2020. India, total Telangana and infected recovered other states, confirmed, recovery rate, %. Total deaths, deceased, death rate, %. Doubling rate active cases, total deaths and total recovered, India 34,313 8,853 25.8 1,143.3 11 days 24,320 Telangana 1,012 more cases Maharashtra 10,512 367 1798 36.2 26 17.1 464 2.5 70.8 days 619 4.4 10 days 8,250 Gujarat 4,390 620 14.1 213 4.8 10 days 3,557 NCT of Delhi 3,564 best performed Haryana 310 1106 209 31.0 58 67.43 1.6 13 days 2400 0.96 25 days 98 Kerala 604 379 62.74 0.66 37.5 days 221 Tamil Nadu 2266 0 cases Daman and Diu Sikkim 0 Nagaland Dadra and Nagar Haveli Lakshadweep 1252 055.2 29 01.2 19.1 days Source, Koi, Arajya Setu App https://telanganatoday.com/ doubling rate of COVID-19 cases at 11 days Center Note, performance of a state depend upon recovery rate, death rate, and doubling rate. 3 reasons for spread of COVID-19, negligence of China. China did not take immediate action and not alerted the WHO in time during COVID-19. This is confirmed by Wuhan Diary written by Wang Fang. In her online diary she mentioned a doctor friend said to me, in fact, we doctors have all known for a while that there is a human-to-human transmission of the disease, we reported this to our superiors, but yet nobody warned people. She also wrote about shortage of masks. Today, because of China, COVID-19 has become global pandemic and whole world is suffering. Indian government's action, the WHO declared coronavirus as a global emergency on January 30, 2020 and the first case of COVID-19 was also reported on the same day in India. But, the government did not stop the travelers from abroad to India till December 3, 2020. COVID-19 imported to India through foreigners. Though, government had initiated action, if it had acted much earlier as a preventive measure, the number of cases would have been much lesser than today. US President Trump said COVID-19, a hoax. He has underestimated the impact of COVID-19 even after seeing several deaths in Italy and Spain and delayed the action. Hence, the number of cases are increasing in US very rapidly and huge number of people are infected and dying daily. Stages of COVID-19. According to Indian Council of Medical Research, ICMR, there are 4 states of COVID-19 disease: Stage 1, imported cases; Stage 2, local transmission; Stage 3, community transmission; Stage 4, epidemic. At present India is at 2nd stage. Experts say that as stern precautions were being taken, we do not go to 3rd stage, which has happened in other countries like Italy, China, US and Europe. If entered the 3rd stage, i.e. community transmission takes place and becomes epidemic and spreads violently, which causes thousands of deaths per day. According to ICMR, one COVID-19 patient could potentially infect 406 people in 30 days, if he/she doesn't practice social distancing. One insufficient number of hospitals, doctors, nurses and paramedical medical staff. This is also one of the reasons for rapid increase of COVID-19 cases. 4.2. Poor public response. If public do not respond to the instructions of government, medical staff, and police, number of COVID-19 cases will increase within no time. 3. Poor awareness in the public. People not having sufficient information about the COVID-19 will increase the cases. 4. Poor social responsibility. This will augment and spread number of COVID-19 in the country. 5. Insufficient virology test labs and required medical equipment. This is also important factor which will increase COVID-19 cases. 6. Tablighi Jamaat meet turns COVID-19 super spreader. Due to Markaz International Religious Congregation, 80% of the COVID-19 cases are confirmed from the Muslims who have attended Tablighi Jamaat Markaz. 7. Delay in response. In Italy, Spain, and in other countries, delay in response has contributed to the spread of COVID-19. 8. Patients misbehaving with doctors. Some people and patients, especially Muslims who attended Delhi Nizamuddin Markaz religious congregation, are misbehaved with medical staff, which aggravated the situation. This is highly deplorable. 9. Doctors' complaints. In some states of India, doctors are complaining that they have not been provided with required safety equipment, staff, medicines, and life-saving ventilators. This may lead to the spread of COVID-19 cases. 10. Neglecting preventive measures. We all know that prevention is better than cure. Neglecting preventive measures will spread COVID-19 cases at jet speed and will lead to several deaths. 11. Scarcity of hospitals, doctors, medicines, medical equipment, and PPEs. COVID-19, a biowarfare virus. Till date, there is no established proof that it has been created in a lab for biowarfare. In fact, the scientists concluded that it was the result of natural selection and not the product of genetic engineering. Recently, WHO also confirmed the same. Though, US President Trump called COVID-19 as Chinese virus, no evidence shown. Moreover, within a short time he sought China's help to combat COVID-19 collectively. Democracy vs. dictatorship. Amartya Sen has rightly pointed out that where democracy prevails, governments will take care of public welfare. In contrast to this, dictatorship governments will neglect public welfare. This is clearly evident from the recent outbreak of COVID-19 in China. Though, first case in China suffering from COVID-19 can be traced back to November 17, 2019, and Dr. Li Wenliang, when he first wrote about the virus on social media on December 30, 2019, who later died of COVID-19, was warned by local police. Thus, because of negligence of China, COVID-19 has become a global pandemic. COVID-19, a pandemic crisis, impact on world and India. IMF says this pandemic is much bigger than 2008 financial crisis. UN Conference on Trade and Development, UNCTAD, estimates the economic impact at a minimum of $1 trillion in 2020. As China being a major manufacturing hub, the outbreak of COVID-19 has been seen to pose a major destabilizing threat to the global economy. Concerns have shifted from supply-side manufacturing issues to decreased business in the services sector. There have been widespread reports of supply shortages of pharmaceuticals, masks, with many areas seeing panic buying and consequent shortages of food and other essential grocery items. Some sellers are exploiting this situation and resorting to black marketing and selling the goods at exuberant prices. The technology industry, in particular, has been warning about delays to shipments of electronic goods. Dr. Panos Kouvlis, director of the Boeing Center at Washington University in St. Louis, estimates a $300+ billion impact on world supply chain that could last up to 2 years. The Organization of Petroleum Exporting Countries, OPEC, reportedly scrambled after a steep decline in oil prices due to lower demand. Due to a significant rise in the number of COVID-19 cases, by February 28, 2020, stock markets worldwide saw their largest single-week decline since the 2008 financial crisis. As the pandemic spreads, global conferences and events across technology, fashion, and sports are being cancelled or postponed. While the monetary impact on the travel and trade industry is yet to be estimated, it is likely to be in billions and increasing. News reports indicating that the effect of COVID-19 on the U.S. economy will be worse than expected. The pandemic has affected educational systems worldwide, leading to the widespread closures of schools and universities. According to data released by UNESCO on 25/03/2020, schools and universities closures due to COVID-19 were implemented nationwide in 165 countries. This affects over 1.5 billion students worldwide, accounting for 87% of enrolled learners. Shops and malls closed. In many of the world's major cities, planned travel went down by 80 to 90%. International 6 Air Transport Association has predicted on July 3, 2020 that nearly 25 million jobs are at risk due to COVID-19 crisis. It is estimated that the impact of COVID-19 is more than the attacks on WTC, November 9, 2001. In India, the first case of COVID-19 was reported on 30/01/2020. The outbreak has been declared an epidemic in more than a dozen states and union territories, where provisions of the Epidemic Disease Act 1897 have been invoked. Educational institutions, many commercial establishments have been shut down and suspended all tourist visas, as a majority of the confirmed cases were linked to other countries. On February 3, 2020, the BSE Sensex witnessed a flash crash. After whose declaration of the outbreak as a pandemic, November 3, 2020, next day itself, i.e. on December 3, 2020, Indian stock markets suffered their worst crash since June 2017. On 22/03/2020, India observed a 14-hour voluntary public curfew at the insistence of the Prime Minister Narendra Modi. Further, PM announced 21 days lockdown from 25/03/2020 to 14/04/2020. Lockdown extended from 14/04/2020 to March 5, 2020. Lockdown is further extended from April 5, 2020 to 17/05/2020. Some relaxations in orange and more relaxations in green zones are granted, but strict conditions in red zones/hotspots to contain COVID-19. To prepare themselves for likely emergencies, with the COVID-19, the public cash withdrawals from banks hit a 16-month high. They withdrew 53,000 crore during the fortnight ended March 13, according to the data released by the RBI. A UN report estimated a trade impact of $348 million on India due to the outbreak, making India one of the 15 worst affected economies across the world. Asian Development Bank has estimated that the outbreak could cause losses of up to $29.9 billion to India's economy, and GDP may fall up to 1% in the financial year 2020-21. It could lose an estimated 3 million tourists in the calendar year 2020 and foreign exchange of about $7 billion in related sectors. The WHO Executive Director Michelle Ryan said that COVID-19 impact on India will be enormous. Economic devastation caused by the lockdown has huge effects on migrant laborers, informal workers, micro and small enterprises, farmers, and the self-employed, who are left with no livelihood in the absence of transportation and access to markets. Due to lockdown effect, 90% of the trucks are off the road. According to ILO, 400 million Indian workers may sink into poverty. All these problems hitting the world of work from multiple directions, companies are finding it difficult to sustain in this environment. They are forced to take tough decisions such as cutting down the salaries, giving pink slips to employees and opting for other cost-cutting measures. Telangana and AP states has resorted to cuts in the salaries of public representatives, government employees, and pensioners. Central government announced that DA and DR of employees and pensioners will be frozen from January 1, 2020 to January 2021. While it makes all the sense in the world to stay at home and work, rather than be in a crowded office environment, it is affecting the non-IT companies, especially the small and medium enterprises, SMBs. The outbreak has presented new roadblocks for the Indian workforce and especially for the daily wage and contractual workers. It is reported in Pune that domestic violence increased during the lockdown period. COVID-19 a blessing in disguise. It is a blessing in disguise for the planet as climate scientists forecast a drop in carbon emissions, which improved the quality of air. The Indian sector has long been dependent on China to critical source imports. The good sign is now, a $163 billion chemical industry struggles to reduce its dependency on Chinese imports. Including USA realized that dependence on China for its essential medicines is dangerous. The large-scale lockdowns across the globe has led to decrease in carbon emissions which will ultimately benefit the planet. Reduction in energy use and emissions mostly due to drop in electricity use, industrial production, and transport benefited the countries across the world. Analysis from Stanford University found a drop in nitrogen dioxide across the planet could save large number of lives. Environmentalists have calculated that the pollution reduction has saved several lives across the globe. Current COVID-19 pandemic threat has opened new ways like offering online classes on sustainability, life skills on communication, stress management, mental health, yoga etc. By taking advantage of this situation, we can ensure through e-learning that education does not come to a standstill and every child receives the education they rightly deserve. We can also make use of this situation to read books, writing, listen to music, learn something new, talk to a loved one, relatives and friends, seek spiritual comfort. Indian traditions to combat COVID-19. As COVID-19 is spreading all over the world and creating havoc, Indian Namaste is becoming popular across the globe to avoid physical contact. Ministry of Ayush is advising to use traditional ancient medicines like Ayurveda, yoga, and naturopathy, Unani, Siddha, Soarikpa and homeopathy to contain COVID-19. Myths vs facts. Myth 1, eating garlic or lemon, and other foods commonly used as home remedies for flu and common cold, can help to prevent infection of COVID-19. This is false. 8 fact. Garlic is a healthy food that may have some antimicrobial properties. Similarly, vitamin C is an essential nutrient that can support immune function. However, there is no evidence from the current outbreak that eating garlic or lemon, or other foods for that matter, has protected people from COVID-19. Myth 2, regularly gargling with salt water or saline can help to prevent infection with the COVID-19, as well as drinking water to flush the virus from mouth. This is false. Fact, there is no evidence that regularly gargling has protected people from infection with COVID-19. While this may help soothe the sore throat, but this practice will not prevent the virus from entering the lungs, neither will drinking frequent sips of water. Myth 3, drinking warm water and getting enough sunlight are effective in preventing COVID-19. This is false. Fact, drinking warm water and getting enough sunlight may have health benefits. Sunlight is good to get vitamin D, but too much exposure to sunlight may also lead to sunburn. Myth 4, taking a hot bath can prevent COVID-19. This is false. Fact, taking hot bath will not prevent from catching COVID-19. Myth 5, hand dryers are effective in killing COVID-19. This is false. Fact, hand dryers are not effective in killing COVID-19. Myth 6, spraying, drinking alcohol or chlorine all over the body can kill COVID-19. This is false. Fact, spraying, drinking alcohol or chlorine all over the body will not kill the viruses. Myth 7, vaccines against pneumonia can protect from COVID-19. This is false. 9 Fact, no vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B, HIV, vaccine, do not provide protection against the COVID-19. This virus is so new and different, it needs its own vaccine. Myth 8, the new coronavirus can be transmitted through mosquito bites. This is false. Fact, till date, there is no evidence that COVID-19 could be transmitted by mosquitoes' bites. Myth 9, COVID-19 affects only older people. This is false. Fact, people of all ages can be infected by COVID-19. Of course, old people and people with pre-existing medical conditions, such as asthma, diabetes, heart disease, are more vulnerable to COVID-19. Who advises people of all ages to take appropriate steps to protect themselves from this virus? How long can COVID-19 virus live on surfaces? According to a recent study published in the New England Journal of Medicine, SARS-CoV-2, the virus that causes COVID-19, can live in the air and on surfaces between several hours and several days. The study found that the virus is viable for up to 72 hours on plastics, 48 hours on stainless steel, 24 hours on cardboard, and 4 hours on copper. It is also detectable in the air for 3 hours. But the important point one should know is that the virus that remains is less than 0.1% of the starting virus material. Impact of summer on COVID-19. Recently, U.S. scientists observed that solar light appears to have on killing the virus, both surfaces and in the air, increasing the temperature and humidity or both is generally less favorable to the virus. Summer-like conditions will create an environment where transmission can be decreased. But the rate of infection is likely to increase in fall and winter. COVID-19, airborne transmission may be possible. To date, there is no concrete evidence in this regard. But it is a droplet transmission. COVID-19 virus's viability in exposure to heat or cold, there is no evidence, but an unpublished research predicts that temperate warm and cold climates are the most vulnerable and tropical parts of the world are likely to be least affected. State role to contain COVID-19, 10 First of all, immediately declaring health emergency in the country. Alert the public regarding their social responsibility. Stopping the people who are traveling from abroad and arriving the country. Providing sufficient funds, medicines, and equipment. Like China, if existing hospitals and beds are not sufficient, immediately without loss of time, additional temporary hospitals should be constructed, and the number of beds should be increased. Additional number of doctors, nurses and paramedical staff should be appointed according to the requirement. Local governments should keep their villages, towns, cities, and metros cleanly. Above all, commitment of the government is very essential. Because, as the saying goes, Yad Haraja Thad Hapraja, people will follow the government. If necessary, government should declare ESMA, Essential Maintenance Service Act, to obtain health services, doctors and hospitals. Social/public responsibility to contain COVID-19. At this juncture of pandemic, public must support the government scrupulously in all respects, and they should realize that government is there for their welfare only. For their safety and for the safety of the whole society, they should stay safely in their homes, support the government and realize their social responsibility. Public should not believe the unscientific methods and treatments which are circulating in social media, i.e. in YouTube, Facebook, Twitter and WhatsApp. Dissemination of scientific information and to spread only necessary correct preventive steps to be followed to contain COVID-19. Spreading of superstitions is an offense and punishable, hence one should avoid. Supporting the doctors is vital. They should listen and follow what they say. People should contribute liberally donations to the PM and CMS Relief Fund. Maintaining neatness and keeping their surroundings cleanly. NGOs' role, in this crisis, all non-governmental organizations, NGOs, must support the government and extend all help to the public. Medical and health role to contain COVID-19, all the medical staff, doctors, nurses, paramedical must work with commitment and responsibility. 11. As a social responsibility, they should inform the public through social media regarding the preventive steps to be taken to contain COVID-19. They should inform the government and get the required safety tools, medicines, medical equipment, and additional staff immediately. They should also alert the government regarding the establishment of new virology testing labs, R&D centers, and other requirements if any. Police role to control to COVID-19. Police should play a key role in this crisis to make lockdown a success. Police must not behave rudely and caning the public by following traditional methods of punishment. Instead, through counseling they should convince them. They should act as a liaison between the public and government. Preventive measures to combat COVID-19. We all know that prevention is better than cure. Hence, we should all follow the following preventive measures. 1. Spreading key measures to prevent the COVID-19 infection. 2. Taking actions for early detection and referral of suspected COVID-19 cases. 3. Maintain social distance. It will slow the virus down. 4. Avoiding gatherings in melas, markets, gatherings in religious places, social functions, etc. 5. Staying at home. 6. Avoiding physical contact like handshakes, hand-holding or hugs. 7. Avoiding touching surfaces such as tabletops, chairs, door handles, etc. 8. Washing hands frequently with soap water/sanitizer. 9. Avoid sharing of objects like pen, paper, phone, etc. 10. While coughing or sneezing, covering nose and mouth with handkerchief. Washing the handkerchief at least once daily. 11. It is preferable to cough/sneeze into bent elbow rather than in palms. 12-14. Following persons should be quarantined for 14 days at home as a precaution. A. People who have traveled to COVID-19 affected countries/areas in past 14 days. B. Those who have come in close contact with a suspected/confirmed COVID-19 patient. C. Those who develop symptoms of COVID-19. D. Even people with the COVID-19 infection, but no symptoms. 16. If symptoms become severe, concerned person should call helpline or visit a health facility. 17. Sharing the information about people who have traveled to other countries or other states inside India in last 14 days. 18. Monitoring the people who have developed the symptoms of COVID-19. 19. To give instructions to the persons being home quarantined and to ask them to stay in a separate room at home, if possible with an attached/separate toilet. 20. Infected persons/others who go out of homes should wear a mask/clean cloth. 21. Not to touch eyes, nose, and mouth with unclean hands. 22. Ensure that the surfaces and objects are regularly cleaned. 23. Prophylactic treatment should be given. 24. Take care of older people, pregnant women, newborns, sick children, postnatal. 25. Avoid unnecessary visits to medical facilities so that doctors can serve better COVID-19 affected patients. Recent updates of COVID-19. Central government divided districts/areas into red, orange, and green zones. Where sizable number of cases, 80%, were detected in the last 14 days are declared as red zones or hotspots. In these areas all activities, except essential services like medical emergencies and law enforcement, will be stopped. Where only a few cases were found in the past 14 days with no increase in the number of positive cases are declared as orange zones. Where there is no single case of COVID-19 in the last 28 days are called green zones. In green and orange zones limited public transport, some agricultural activities with strict guidelines like social distancing are allowed. In these two zones, MSMEs and 13 REGA will resume operations. In India, 400 districts were declared as green zones. On the basis of above said rules, the zones will change. The containment zones are marked if more than 4 cases of COVID-19 are reported. Scientists at Delhi's CSIR, IGIB have developed a paper-based test strip called Feluda test for COVID-19. This test is 100% accurate and cheap. Government recommended to download Arogya Setu app, which is a coronavirus tracker, can help a user to identify possible coronavirus hotspot. In Kerala, COVID-19 curve flattened, while in Telangana the curve started bending downward. Coronavirus mortality rate in Kerala is 0.66%, but in the world it is 7%. The current, as on 30/04/2020, fatality rate for COVID-19 is 3.2% in the country, with 65% of the victims being males and 35% are females. Looking at the age distribution of the deaths, 14% case fatality was seen below 45 years, 34.8% between 45 to 60 years, and a 51.2% case fatality was noted among those above 60 years. Further, if we divide the mortality cases above 60 years, then we see that the mortality has been 42% in the age group of 60 to 75 years and 9.2% in those above 75 years. In India, due to lockdown impact, COVID-19 cases doubling rate slows down from 3.5 days to 11 days and recovery rate is 25.8%, while in Haryana and Kerala it is 67.4% and 62.7%. On 30/04/2020, government passed an order to allow interstate movement of migrants, students, and others to reach their respective destinations, subject to certain conditions, i.e. they should travel by special trains, Shramik rails, with all preventive measures. It is declared that Oxford Vaccine Group, UK's super vaccine for COVID-19, will be ready by September/Oct. 2020. It will be manufactured in India also. Started its clinical trial on Elisa Granato, the first volunteer in an initial group of 800. COVID-19 infection among kids, a new symptom of navel coronavirus, is reported from Italy and Boston, US. Some doctors reported it as COVID-19. Chinese top scientists say that COVID-19 will not be eradicated and will likely return in waves like flu. As the lockdown is extended from April 5, 2020 to 17/05/2020, there will be no trains, domestic and international flights, schools and colleges, hotels, no interstate buses, cinemas, etc. Inter-district buses are permitted. Extending the lockdown is only the temporary solution to contain COVID-19. Revival of economy is also more important. Hence, government should examine all options and take necessary steps in this direction. Challenges of COVID-19. The following are the challenges of COVID-19. 1. Prevention, implementation of preventive measures. 2. Government, decisive government leadership. 3. Information to the public, spreading information to the public widely. 4. Public response, people support to government. 14.5. Detection and reporting, early detection and reporting for epidemics of potential international concern. 6. Evaluation, evaluation of medical resources and response systems. Measures/lessons for future, ensure correct detection and diagnosis of viral diseases. Providing clear guidance to the public about the degree and scope of lockdowns. Implementation of preventive measures down to individuals is vital. Stern action against the people who are not cooperating to combat COVID-19. Keeping essentials like food and supplies flowing through organized, government-controlled arrangements. Designating infectious disease care and management facilities to isolate, monitor, and treat positive cases. Establishing electronic recording and tracking systems and local response teams to handle identified cases 24/7. Establishing centralized reporting and communication channels to keep citizens informed. To eliminate the source of infection, prevention and control is essential. Government should encourage research and development by providing more funds to prepare vaccine and medicines to contain viral diseases. Establish more virology labs to test the viral diseases. A comprehensive health system should be designed to face viruses like COVID-19 in future. At present, India is just spending 1.17% of the GDP on health, National Health Profile 2019. It should be raised at least to 5 to 6% of GDP. While protecting the health of the public, it is the primary duty of the governments to protect the livelihood of the public. Hence, governments must take suitable measures in this direction. Provide required infrastructure in hospitals to combat viral diseases. Ensure required number doctors and paramedical staff to combat viral diseases. Conclusion: to conclude, who altered the whole world to be careful and warned that COVID-19 will last for longer time. If we neglect, it will ignite. At present, there is only symptomatic treatment, but no correct medicine/vaccine to fight COVID-19. Hence, prevention and stay at home is the only solution. References: 15 https://www.resetarchgate.net/publication/33995460_score_on_healthcare/biotech/healthcare/community transmission of COVID-19 is inevitable /article show/74621197.cms from =MDR https://www.sciencedaily.com/releases/2020/03/203171754442.htm https://www.who.in/western-pacific/emergencies/covid-19 https://n.wikipedia.org/wiki/ 2019% E2% 80% 9320_coronavirus_pandemic https://economictimes.indiatimes.com/smallbiz/SME sector/A163- billion industry struggles to reduce its dependency on Chinese imports/article show/74942617.cms from =MDR https://economic_impact_of_the_2019% E2% 80%9320_coronavirus_pandemic_ in India https://n.wikipedia.org/wiki/impact_of_the_2019% E2% 80% 9320_coronavirus_pandemic_ on_educatio n https://www.who.in/emergencies/diseases/novel coronavirus 2019/advice for public/mythbusters https://www.worldometers.info/coronavirus/is/c=010702 Arajya Setu app https://telanganatoday.com/doubling rate of COVID-19 cases at 11 days center https://www.covid19india.org/https://www.businesstraveler.com/businesstravel/2020/03/11/coronavirus India suspends visa on arrival for Japan and South Korea /https://www.indiatoday.in/india/story/covid-19 in India Mhat allows stranded to return home hints at lockdown relaxations as tally nears 32-000-1672642-2020-043016